Hello, my name is David Affleck. I'm a cardiothoracic surgeon at St. Mark's Hospital in Salt Lake City. I've been asked to talk to you today about smoking cessation. Smoking affects many other organ systems other than the lungs. While it causes lung cancer and emphysema and pulmonary fibrosis, it also affects blood pressure and heart disease. That's probably the single biggest thing outside of lung cancer that I worry about as a cardiothoracic surgeon. Smoking cessation is probably the only thing that we could do to seriously decrease the number of cardiovascular deaths that we see each year in the United States. In the United States, the exposure to secondhand smoke is thought to cause about 46,000 deaths from heart disease. So 3,000 deaths from lung cancer, but 46,000 from heart disease. Again, as a cardiothoracic surgeon, I deal with the heart and the lungs, and cardiovascular disease is a major problem in this country. Almost 46,000 deaths as a direct result of secondhand smoke. So a common question that patients ask me goes something like this: Doc, I've been smoking for 40 years since I was a teenager. I'm 65 years old. What does it matter now? I tell them that on smoking cessation, their lungs begin to repair themselves almost immediately. In fact, within about 7 to 10 days, the cilia, or the little finger projections that are paralyzed by the cigarette smoke, begin to work and clear particles and mucus out of the lungs. And over time, the actual lung function studies dramatically improve. In fact, over the course of just a couple of months, we'll see dramatic improvements in the lung function that can be measured by smoking cessation. So patients that are coming to me for heart surgery, for example, I will insist that they quit smoking before I'll do surgery on them, even to the point if they'll quit for 7 to 10 days, because I know their lung function will be so much better even in that short period of time. So the immediate health benefits of smoking cessation are significant. They include an improvement in the circulation, improvement in the lung function, a decrease in the level of carbon monoxide in the blood. What's interesting is people have carbon monoxide detectors in their home, yet cigarette smoking increases carbon monoxide levels in the blood. All of these improvements can be expected to begin to occur almost immediately on smoking cessation and continue to improve your health over time. The amount of phlegm produced will decrease, and your health benefits will be seen for years to come. I counsel my patients who want to quit smoking to use the most tried and true methods. Those are nicotine replacement therapy, so such as gum or patches, in combination with behavioral therapy, and that could include the use of a counselor or a quit coach, those sort of things. I often get asked questions about electronic cigarettes, and there's no data at this point to suggest that using an electronic cigarette allows a patient to quit smoking. So right now the recommendations are nicotine replacement therapy and behavioral therapy, and those are again things that we can provide for the patient, the resources for the patient that wants to quit. In addition to nicotine replacement therapy, there are 2 web-based resources available to patients and clinicians. One is smokefree.gov and the other one is waytoquit.org. It's important to not feel bad if you fail your first time or your second or third or fourth or fifth, but that you keep trying, because you may not be successful on the first try, but being successful will improve your life dramatically. There's some sense of guilt when a patient tries to quit smoking and they're unable, or they relapse and they don't want to talk to their doctor. I assure you that there is no judgment. The doctor wants what's best for you, and you should discuss this with him or her and continue to try to quit. Keep trying, no matter how many times it takes to eventually quit.